One of the riskiest things a person can do when they go on Medicare is to choose to go with Medicare A and B only. And the reason for that is there's some serious financial liabilities that they have to assume by having A and B only. Most people don't want that risk, and so they will buy a Medigap policy to fill in those gaps. In this video, I'm going to explain how they work. Now, just a quick review. When people go on Medicare, there are two different ways in which they can use their Medicare benefits. Two systems, what I call them. One system is to stay enrolled in Medicare A and B, and because Medicare has gaps, then people will add a supplemental plan to that coverage to fill in the gaps either fully or almost in full. I'm going to explain in detail how it works. But I want to make sure you understand there's another way in which people can use their Medicare benefits, and those are called Advantage plans, and these are replacement plans or C plans. So this is when someone goes to a private health insurance company to replace A and B for them, and they allow that health insurance company to provide that coverage instead of original Medicare A and B. All right, so what we're going to focus on now is those that select to have A and B with the supplemental plan. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. Now, original Medicare is broken up into 2 parts called parts A and B. A is pretty much everything that's going to be inpatient type services. B is going to be pretty much everything that would be outpatient services as well as all doctor services. And so what we have in the original Medicare system is you go to the doctor, you go to the hospital, you're pulling out your Medicare A and B card, and here's what you'd be liable for. And so what we have, if I'm using Part A, it means I'm in the hospital. I have a deductible. This year, 2023, that deductible is $1,600. And this just simply means that this is my out-of-pocket expense before Medicare begins to pay. Now, this deductible covers us all the way up anywhere between 1 to 60 days in the hospital, which frankly is about 99% of every situation. That's a long time to be in the hospital. So it doesn't matter whether I'm in the hospital 1 day, 2 days, 10 days, 30, or 60 days, the out-of-pocket expense to me is the same. I have to meet my deductible of $1,600. Now, if I'm in the hospital longer than 60 continuous days, very rare, but when it happens, Medicare then begins to charge me a daily copay. This year, that's $400 a day if I'm in any days during month 3. If I'm still in the hospital beyond month 3, now I get into what is called extended hospital stays, and now it costs me $800 a day in copay. Okay? And so again, these are rare, but when they happen, you'll notice they're very, very expensive. Now, the second item in which Medicare A covers is skilled nursing facility. Skilled nursing facility. So here's the way it works. Medicare says for the first 20 days in skilled nursing, it doesn't cost you a penny, as long as we were in the hospital at least 72 hours or longer before we go to skilled nursing. So 72 hours stay or longer, 0 to 20 days didn't cost you anything. But after that, if I'm still in skilled nursing facility, days 21 to 100 will now cost me $200 a day copay that you're responsible for. All right. Now, skilled nursing would be after someone's had a stroke, maybe a hip replacement, so they're going in for fairly intensive rehab. First 20 is on Medicare. The next 80 days you still have coverage. Medicare covers everything, but now you have to pay a $200 a day copay. And here's my point. This is one gap. This is your second gap, extended hospital stays, and extended skilled nursing stays makes your third gap. Now let's talk about the B of Medicare. Remember, this is everything outpatient as well as all doctor-related services. So these are the doctors that you go to see in their office or they come to see you in the hospital. Surgeons, anesthesiologists, ER doctors, hospitalists, all paid through Medicare Part B. So what we have, again, we have a deductible. That deductible this year is $226. So the first $226 would be your responsibility. Now I'm going to explain something real quickly. These 2 deductibles vary in that the B deductible is once a calendar year. This deductible on the A side could happen multiple times in the year. And here's how it works. The A deductible is tied to a benefit period. The benefit period begins when you're admitted to the hospital, and then let's say we're discharged 7 days later. From the date of discharge for the next 60 days, I am still in my benefit period, which means if I have to be re-hospitalized because of the thing that put me in the hospital, if I have to go back in anytime within 60 days of my original discharge, I am still in the same benefit period, covered by the same deductible. But if I'm admitted, discharged 7 days later, 60 days goes by, I don't have to go back to the hospital, but I have to after that, then I go back to the hospital and I will owe another deductible and I will start a new benefit period. This deductible is not tied to a benefit period, it's tied to a calendar year. And so if I start Medicare in January, I got a $226 deductible. If I start Medicare in July, I still have a $226 deductible. They don't prorate that. It's a very small deductible. Once I've satisfied the deductible, then I go into what is called coinsurance. Okay, coinsurance, which means what? Medicare pays 80% of the bill and you're responsible for 20%. Now we have two types of payments in Medicare. We have copays and we have coinsurance. A copay is always a flat dollar amount. $200 a day, $400 a day, $800 a day. When it comes to coinsurance, it's a percentage of the bill. So Medicare pays 80% of the bill, you're responsible for 20%. Now your problem on the coinsurance is there's no limit to that. It just keeps going and going and going. The biggest problem is that's where all the doctors are paid. So if you have a serious illness, if you have A and B only, you're gonna have to pay 20% every time you see a doctor, if you have an operation, the surgeon, the anesthesiologist, and these can be things that really can hurt people financially. And then the last gap on the B side of Medicare is called an excess charge. Now, I want you to know when it comes to excess, only physicians can do this. A surgeon, primary care doctor, a specialist, they're the only ones that can do excess. And what that means is this is when they add 15% to the bill. In other words, they take Medicare patients and they can bill Medicare, but they don't accept Medicare approved amounts as payment in full. They add to the bill. And again, there's some that will do this. They say right now about 1 out of 10 providers will do it. Most cancer specialty hospitals are going to do this. Cancer centers. If you go to Mayo Clinic, I know in Arizona, they add the 15%. The doctors will. Now, there are about 8 states in the country that don't allow excess charges to be added. And if you live in one of those states, if you go to a physician in the state, they can't add the 15%. Now, you could go out of the state and have to need care, and then they certainly can add to it, but those 8 states are off limits for excess charges. But my whole point is this, those are your 3 gaps on the B of Medicare. So we have 3 gaps on the A, 3 gaps on the B. Now, most people don't like the liability, especially of that 20%. So what most people will do that stay in A and B is they'll go out and they'll purchase a Medigap policy. It's also called the Medicare Supplemental Plan. Those are synonymous. And so there's a variety of companies, there's a variety of options. There's actually 10 different plans to choose from. These plans are standardized by Medicare, which means Medicare sets the rules as to what bills are going to be paid and what won't be paid. Okay, 10 plans. They're given letters. A, B, C, D, F, G, K, L, M, and N. 10 different letters, okay? Now, I'm not going to look at all 10 of those during this brief video, but I do want to tell you about the top 3. The 3 that the majority of people buy, I would say probably 95 to 97% of all people that get a supplemental plan buy one of 3. Okay, so first off, we have what is called the Plan F. And the Plan F covers 6 of the 6 gaps. So 3 on the A, 3 on the B. We have thousands and thousands of clients on Plan Fs today, and we tell them all, if you get a bill, don't pay it. You should never get a bill on an F plan. As long as Medicare pays first, that gap that remains, that F plan will fill the gaps in, all right? And so it truly is full coverage. Now, the issue today with the F plan is this. Many people can't buy it. They've been phasing the F plan out now for several years, and so here's the rules. You have to be born before January 1st, 1955, which means you were eligible for Medicare before 1/1/2020, okay? So if you're born before those dates, eligible for Medicare before those dates, then you can still get an F plan, and you can keep the F plan the rest of your life. All the people who have F plans, they're not losing them. That group was grandfathered in. Okay, but if I'm born after January 1st, 55, therefore Medicare eligible after January 1, 2020, what happens? You can't get the F plan. It's not an option. You can get what is called the G plan. This is the most popular one today. And what it does, it covers in 5 of the 6 gaps. Okay, the gap it does not cover is the B deductible. So if you have that G plan this year, you would be out of pocket $226. It's the only gap not covered by the G plan. F covers 6 of 6, G covers 5 of 6. So the first $226 that's coming through the B of Medicare, all those outpatient services, all the doctor services, durable medical equipment, all that stuff, you would pay the first $226. Once you've met it for the year, you're done, 100% coverage, okay? And then lastly, we have a plan called an N plan today. Not as popular for sure as the G plan, but again, some people buy this. And what it covers 4 of the 6 gaps plus some copays, okay? So it covers 4 of the 6. So what it doesn't cover if you have the N plan is it won't cover your B deductible, so you're gonna have to pay that out of pocket just like the G. The only one that covered the B deductible is the F plan, okay? But the N plan will not, and then the N plan will not cover excess. So remember what that is. That means when you go to that doctor, that adds the 15%. If you have an N plan, you're going to have to pay that out of your pocket. Again, not a tremendous amount of risk, but still a possibility. And again, that could change in 10, 15, 20 years. For all I know, half doctors that take Medicare are going to add that to that. We have no idea whatsoever. But the point is, if you have an N plan, then you would be responsible for excess. And then we have a couple copays that you would pay. If you go to a doctor, they can charge you up to a $20 copay. And if you go to the emergency room, they can charge you up to a $50 copay. All right? And so we have some additional copays. And so obviously, if we have full coverage, that premium is going to be higher. We go down a little bit. The G plan covers everything but the 226. Premium is going to go down. And then the N plans even go down a little bit further. Why? Because you're taking on that risk. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. And really, that's what you have to decide. How much risk are you going to be comfortable with, all right? And so depending on where you live, these plans are going to vary. Average right now, and again, please, this is average. Some states are going to be a little higher, some a little bit lower, but right now the plan Gs are ranging in the neighborhood of about $125 a month. And so you pay $125 a month to get rid of 5 of the 6 gaps. You got to meet that once a year. So it's almost a full coverage plan. If you could get a G plan, again, those are ranging right now, average about $175 a month up for that F plan. Okay, full coverage plan. And again, you have to have these restrictions because of birth date. And the N plan right now, average is going to be right around $90 to about $100 a month. So we can certainly save money versus the N, but we have to be comfortable taking on excess and these copays that we'll have to pay every time that we see a doctor. Okay, so again, there's no right or wrong. You have to look at your situation, decide which Medigap policy is going to be best for you.